Hello, 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 everyone. Welcome, welcome. I'm so glad you can join us today. I see folks are starting to populate in from the waiting room. I hope you enjoyed our little video talking a little bit about ADOS and some of the work we've been doing here in Philadelphia. My name is Kevin Schott. I am the Director of Engagement for the ADOS LGBTQ plus Health Initiative at the University of Pennsylvania. I wanted to start off today just by thanking all of you for making time to be with us today. I know we're in really challenging times. The past few weeks have been hard for a lot of us. And I really do hope that we can find some space and time together here as a way to sort of address some of the things on our mind and to find some solace in community. So again, thank you so much for being here and making the time to join us for this conversation. I am going to go ahead and get started. So I'm going to share my screen and tell you a little bit more about ADOS and kind of talk a little bit more about the topic that brings us here together today. All right. So here are our lovely panelists you'll be hearing from shortly. But first, like I said, let me tell you a little bit about ADOS and the work that we have been doing. So we are based at the University of Pennsylvania School of Nursing. And it's our idea at ADOS that the LGBT community has never actually lacked from innovation, energy, or work being done to protect our health. One of the big challenges for us, however, has been this information has too often been siloed. There's been too many barriers between us. So if you look at a diagram over on the right-hand side, hopefully in that constellation, you see some of your own background, maybe your own sector there. Healthcare providers, business owners, policy writers, community advocates, researchers, government workers. For all of history, people have been doing great work to sort of champion the well-being of LGBTQ plus people. But what we hope to do at ADOS is find ways of connecting with one another, building our network and building our community. So thank you so much for joining us today for this connecting conversation. Be part of that work to sort of unite us and find the best ways to accelerate our work and provide the best offerings for our own community's well-being. The reason why we cast this wide net, the reason we want so many people engaged and communicating with one another is that things that cause LGBTQ people to have poor health are so complex, so diverse, right? It's not just your doctor or your hospital or the clinic you go to. Your health has a lot to do with whether or not you have a safe school environment, whether there's inclusive policies in your workplace, whether you have safe spaces to go, whether you live close to a bus route, right? There's so many aspects and so many things and so many stakeholders and people involved in supporting the well-being of our community that we think it's important to build these networks for us to kind of maximize our work. And we have to really take this seriously now because those rates of LGBTQ plus health disparities continue to grow. In areas like cancer, cardiovascular disease, mental health, we can find disparities for LGBTQ folks in all of these. And our population continues to grow. Every generation who's found it safe to come out of the closet has come out at greater rates. And so even though it's only 8% of the population now, we know that this is a growing population. And that unfortunately, they've been having a very difficult time accessing health. 16% of LGBT people have experienced medical discrimination, and that burden isn't evenly borne throughout our population. We know that this is harder for the transgender members of our community. 27% outright denied care that they're seeking, right? These disparities won't solve themselves, and it will take many people working together in different sectors, finding ways to maximize our effort to sort of address some of these issues. And so it's in that spirit of sort of cross-sector discussion that today we want to talk a little bit about mental health and our bodies. So before we hear from our panelists, I just wanted to kind of lay some groundwork by talking about some of the connections we can sort of see in this area. So the first question you might have is, how are our bodies even connected with our mental health? The first thing I want to point out here is that unfortunately, for a lot of queer folks, we do not view our bodies as a source of strength. It's very common, unfortunately, for LGBTQ people to see our bodies as a source of unhappiness and distress. The Trevor Project recently released some information showing that 87% of LGBTQ youth are dissatisfied with their bodies. And that dissatisfaction does have a big impact on our mental health. A study in the UK found that 33% of people there who are LGBTQIA report negative mental health specifically due to their body image. That is the cause and driver of their mental health issues. So I want to highlight that unfortunately for many of us, our bodies are not seen as a source of strength because unfortunately, our bodies can be a source of that mental health. So I want to kind of flip this question on its head by pointing out the ways in which our bodies can actually support us. And that's something that our panelists will be speaking a lot about later. One thing I will point out is that the National Institute of Mental Health does recommend 30 minutes of activity every day as a mental health intervention, not just for your physical health, but for your mental health. And there are real tangible drivers of that. Moderate activity can do things like improve your sleep. If your sleep improves, you're less likely to suffer from a mood disorder and have more ability to moderate your mood. So that's a big mental health intervention, just sleeping better. Physical activity is also likely to build your social connections. You'll meet people along the way. You'll engage with different kinds of folks. And having those connections, having people to talk with, people who are like-minded, people to share activities with, that is a big support of your mental health. And then on a really tangible level, exercising can suppress the amount of cortisol, that stress hormone in your body, and relieve stress. So again, this activity, things our bodies can do, can actually support our mental health. So if we know that physical activity can be supporting our mental health, do we know of any disparities in how LGBTQ folks actually engage with that physical activity? I was able to find one survey from 2016 that actually does show some interesting findings. These were all self-reported, but if you look at that chart on the top, that looks at sexual orientation and exercise. So these are folks who are reported exercising 3 times a week. And you'll notice on this scale, lesbian, gay, bisexual, and queer respondents are all less likely to engage in exercise 3 times a week than our heterosexual counterparts. So this is a disparity in how people are engaging with fitness. The chart below looks at gender identity and has similar findings. We see that transgender males and females are less likely to engage in exercise than people assigned female or male at birth. Right? So this disparity is both in sexual orientation and in gender identity. So again, it's something for us important to talk about and consider maybe what are the barriers for LGBTQ people engaging in this physical activity that has this protective effect. There has been a fair amount of qualitative research on this, interviews with different people about their experiences of physical fitness. One of the big barriers, outright exclusion, not having changing spaces, not having teams, not having coaches available, right? Not feeling welcome, not being actually welcome, not even feeling it, but not even actually being welcome, prevents people from engaging in sport and physical activity. Another barrier, interestingly, going back to that point I made earlier, is negative body image. A lot of people don't feel comfortable engaging in physical activity if they're not comfortable in their bodies. This comfort with our own bodies and abilities is a big part of our ability to exercise. So that's another thing that's a barrier. And then finally, there's a sort of binary nature of sports. Now, by no means is sport the only method of engaging in physical activities. There are lots of ways, and we'll hear some more of them later. But the fact that if sport was your preferred method of doing that, that there's a binary choice, men's or women's, creates a barrier for many people trying to enter that space. Now, I never like to leave people with just a sense of like, here are the problems, there's nothing you can do. So I do like for all of us here in this meeting today to think about things we can do. And I sort of divide this into a micro level and a macro level. The micro level are kind of things you can do yourself, right? Things you don't need money, support, an organization, things you can just do for you. The first thing I think to think about is queering your physical activity, right? We talk a lot about queering things at ADOS, by which we mean kind of recasting an experience, but centering it on LGBTQ people. So physical activity, like I said, it doesn't have to be sports. It can be dance. There's a ton of research that says that dance is a really effective intervention against depression and it supports mental health. There's also sports that aren't necessarily team-based, but expressive sports, artistic sports, which we know commonly attract LGBTQ people as members and participants. And then there's also the kind of queer experience of socializing our activities, not thinking of as exercise as something you do alone on a treadmill, but something you do with friends and neighbors and people in your own community. So building some social aspects around the physical activity you plan to get is something that maybe you can do for yourself and we can kind of all do and reflect upon. Now, for those of you here on this call today who work in community-based organizations and policy, who run organizations, Things to think about doing are hosting an affirming recreational event. And again, not just sports, a walkathon, a hike, but something that actually engages the body, engages different kind of folks with it as an actual organizational experience. And then, of course, if you're planning to do that, do make sure to review your policies of inclusion, who you're inviting, how you're inviting them, the words you're using, the people who are in that invite list, to make sure you're truly welcoming all people into your space. So these are some ideas just to get started and some things you might reflect on in this call today. But I have definitely spoken enough, and I'm certainly not the expert on any of these topics. So I'm going to introduce the panelists now and stop sharing my screen. But here are the four people you'll be hearing from today. And I'm going to call them out one by one to tell them a little bit about themselves and ask them some questions about their work. And I'm going to start with Dr. Jennifer Pharr. How's it going today, Jenny?
Great, wonderful day here in Las Vegas, Nevada.
What's the weather like out there?
It's a little cool for us high desert folks, but for those of you out east and in the north, you probably would say it's balmy like 55 degrees right now. So it's nice. Yeah.
The first kind of cold day in Philadelphia, so I should wear a winter jacket.
Okay. All right.
Um, so Jennifer, tell us a little bit about yourself and how you got interested in fitness as like a research topic.
Sure. I have heard someone describe research as me search. So a lot of us in the academy end up doing research on things that are important to us and things that have been significant in our lives. And I would say, as a queer kid growing up in the South in Texas, sports saved my life in some regards. I participated in sports starting at a very young age. Still consider myself and identify as an athlete, though I'm not like on a sports team right now. But as a youth, when back in the 70s, I was often referred to as a tomboy, misgendered often and those sort of things, sort of my safe space and where I could really just be myself and feel like I was seen and appreciated and accepted was when I played sports. And so, I ended up playing sports in high school, college, got a college scholarship. So it helped pay for my undergrad. It's where I met my wife. So sports has had a huge impact on my life, so much so that I got my master's degree in exercise physiology because I really wanted to study sport. And so now, as a public health professor, I wanted to understand. I know that sports has been so important in my life and help me with my own mental health, dealing with things like anxiety. That I wanted to see, is that just something that I experience, or does the bigger community of sexual and gender minority folks experience that same positive benefit from being physically active? And so that's sort of where my research has led me.
So it's interesting. I did in fact invite you here to talk about just this topic because when I was looking for sort of research on this, there is a dearth of information a lot of times about anything related to LGBTQ health. So it was like exciting to see you as a signpost out there doing this work. In 2021, you did publish a paper on exercise as a mitigator for poor mental health for lesbian, gay, and bisexual adults. Before we get into this topic, sort of just what made you interested in doing that research?
Yeah, so I've looked at just in general, does physical activity improve mental health of the adult population? And then does participating in sports specifically improve the mental health of the general adult population? And I found that the answer is yes for both, that being physically active improves mental health, improves decreases the number of poor mental health days, decreases the risk of being diagnosed with depression. And then, even more specifically, that engaging in sports has been really helpful for people with their mental health. So, even sports is a little bit better than people who do like conditioning exercise and things like that. So, after looking at just the general population, it's like, I wanted to see, does the same thing hold true for sexual and gender minorities? Because we know, like you said earlier, that people who are sexual and gender minorities have increased risk for poor mental health outcomes. So can exercise help with that as it does just with the general population? So that's what got me interested in doing this specific article that you're referring to.
So you mentioned that sports and fitness can contribute to that sense of mental health. What are your senses of some of the drivers for why that is true? Like, what can you expect? I know this is a little speculative now, I'm taking you out of the numbers, but what are some reasons we can attribute maybe some of this benefit to?
Yeah, I think just being out there, moving our bodies, we get a lot of the positive endorphins going when we're exercising. And as you mentioned in your introduction, we decrease our levels of cortisol, which makes us feel anxious. It improves our sleep. It improves our socialization with other people, especially if we're engaging in team sports. So there's a lot of reason why exercise just is so important for our bodies. It helps our heart rate be lower if we're do conditioning physical activity over a period of time. So just that, your heart rate isn't racing all the time, just things like that, right? So we see that really across the life course. So we see it with kids who are physically active, we see it with adults, we see it with older adults. So there are just so many tremendous positive benefits for being physically active.
All right, good news for all of us.
Yeah.
So your paper did focus on lesbian, gay, bisexual populations. Were there any limitations that prevented you from being able to look at the impacts for transgender people and other sexual gender minorities?
Yeah, that I really wanted to do the whole broad spectrum of sexual and gender minorities, but the data set that I used is it's called the BRFSS. So it's the Behavioral Risk Factor Surveillance Survey, and it's a survey that's done every year across the United States. About 500,000 adults participate in the survey. It's the CDC in conjunction with the states, and they do a pretty good job of surveying sexual minorities, but they don't do a very good job of sampling gender minorities. And so we don't have a very good population in the sample of transgender and non-binary folks being represented. Because the sample size is so small, we run into statistical issues with trying to do research and some data analysis on such small samples. So that was the real limitation with this data set.
Yeah, I know there's often just this lack of information I had mentioned before with really trying to look at our health. There's often not a lot out there. Do you come up against that a lot in your work?
Yes, there's very little research that's done on sexual and gender minorities, and so I feel like, in a way, it's not great because we don't have a lot of information. But for me as a researcher, it's like I have this just wide open field of research that I could do for the next, decades, because a lot of research hasn't been done in this area. And so I feel like in some ways, sort of, charting new territory and trying to understand the mental health of sexual and gender minority folks and what either contributes to the disparities that we see in mental health, or what helps improve our mental health. So that's, I have a lot of research fields in front of me to look into over the next bit here.
I love your positive spin. You're going to fill in the gaps and make sure we
Yes.
get the information that we need. All
Yeah.
right.
Yeah.
Thank you so much, Jennifer. I'm going to move on to other panels, but don't worry, we're going to do some general questions later. So we're not done with you yet,
Can
Jennifer.
I just, before we move on, can
Absolutely.
I just want to just, so that the study that you pulled up, so looking at sexual minority populations, so those who did not engage in any physical activity reported having 9 days of poor mental health in a month. And those who were engaged in physical activity to the extent that they met the physical activity guidelines that the Health and Human Services gave us, they had about 5 poor days of mental health. So just engaging in physical activity at that, level, it's not outrageous amount that Health and Human Services, recommends, but reduce the number of poor mental health days by almost half, right? And so that's why it's so important that we have safe spaces. And your other panelists are going to talk about safe spaces to be physically active.
I sure hope they are. All right. Thank you, Jenny. Eli, I'm going to welcome you to the stage next. How's it going today, Eli?
It's going pretty well. Like you said, it's the first cold day of the year.
Yeah, yeah. Did you have to step out today and put on your winter jacket?
I get hot really easily, but I did have a sweater on, so
Okay.
that says a lot for me.
Sweater season is a good season. Big
Oh
fan.
yeah, layers, everything.
All right, Eli. So I was wondering if you tell us a little bit about your practice and how you got to be involved in physical therapy.
Sure. I run a physical therapy and personal training business called Ally Wellness. And my focus is on bringing individualized one-on-one care into people's homes, for people in marginalized bodies, which includes the LGBTQ plus community. Uh, my journey to that was a little bit winding, I would say. My undergraduate degree is in environmental science, and I was doing research on a ship on El Nino and La Nina, uh, on weather buoys, and we would be out at sea for like 3 months at a time. And it's a very compact environment. There's like 30 people. You don't see people that often, other people outside of that. And so I started to work out a lot with a group of people on the ship. And after like 2 years of that, when I got off, I was like, well, wait a minute. It improved my mood so much on the ship that I was like, this is kind of what I want to do for my next career. So I literally Googled science credits and working out. And the internet told me I could be a physical therapist or like a forest firefighter. So I went with physical therapy. I'd never actually had physical therapy before, and it kind of all went from there.
Amazing. From shipboard to physical therapy. I love it. Hope maybe we'll find some people in the chat today on a similar trajectory, but you might be the one.
Yeah, it's pretty random.
Now, so you founded Ally Wellness. Can you tell us a little bit about your patient community? Like, who do you find yourself treating? Who are the folks that sort of in your caseload?
I treat a lot of queer and transgender people. I treat a lot of I would say I always describe it as bodies that have been othered by the medical community. So people in fat bodies, people in brown bodies, people in queer bodies. It's mostly people who, when they encounter healthcare professionals, um, the experience is generally less than positive, and so they end up finding their way to me.
So when we've talked before and we met the first time, you mentioned that a lot of the people you work with are kind of told in explicit ways and implicit ways they're not able-bodied, that they're not able to engage in exercise. That's literally why people go to most physical therapists, are told they can't do it. So, but I wanted you to say, what are providers telling your patient community? What are the messages they're getting about their bodies from providers now?
A lot of it is language based, and some of it is also, some shared biases that the society has. But one big thing that people hear a lot is that, if you lose weight, your pain will go away. So like straight instead of having an environment where people are getting full evaluations, some practitioners see a fat person and that is the diagnosis and you're gone. So people learn that movement is not for them, is not safe for them, is not possible for them because they're not in the right type of body that movement should happen in.
Hmm.
Or unless they get the right type of body, they will never be a functioning person.
Wow.
Yeah, go ahead.
No, it kind of goes to that catch 22 before of like, I'm not fit enough to exercise, which are like, how could that be?
Yeah, exactly. And then I think too, how we frame exercise can be a little bit intimidating for people, especially if you're not I grew up playing sports. And so for me, when I hear sports and exercise, I get really excited. Some people hear that and all they think about is how they've been either shamed or excluded from these spaces before. So language around exercise, how do we use better language? Movement program over exercise program. I like to call things movement programs. Um, there's all types of stuff. Another favorite one of mine is that your body's out of alignment. Um, Alignments are different for all people, and when you start telling people that things are out of alignment, um, they they internalize that, and so it affects how they perceive pain, how they perceive their own bodies, and how they perceive their own abilities based on something that's kind of a nebulous idea of perfect alignment.
Hmm. Yeah, so you brought up this idea of connecting with their bodies and things, and being told by others what your body is like or should be. What are some things you encourage your patients to do to connect with their bodies?
um, the first thing I encourage patients to do, which they often find super frustrating, is I ask a lot of questions about what they feel in their bodies, where they feel it, how would they describe it? Like, even if people get nervous because they don't want to use strange words. They're like, it feels mushy. And I'm like, that's okay. Give me your description of how things feel. So the very first intervention for helping people connect in their bodies is starting to have them try to hone in on the feedback that their body is giving them, which can be really hard when you've been in pain for a long time because you're in a place where you're just assuming pain constantly. So even to put your focus on a body part becomes kind of challenging. Um, and then the next most way that's like a little bit more fun is working on things like balance, um, where you have to bring a lot of focus to your body to be able to complete the task. It's not necessarily about um, pure strength. A lot of that is your perception of where you are in space. So you start to work on, from a neurologic level, you gaining appreciation for where your body is in reference to other things. And for that, you have to come into your body to get that done.
Right, you're going to make me do some balance exercises to
Stand
get
on
off
one
this
foot. There you
call. See how aware am I of these things?
go.
So I want to hear a little bit from your point of view, like anecdotally, I guess, in working with your clients or working with your patients to get them to connect more with their bodies, to understand there's those feedback loops that you're mentioning. What are some of the positive you've seen, not just for their body, but for their mental health and connecting more with their bodies?
Um, I mean, mental health wise, I see a lot of people um, start to let go of certain body anxiety. Um, they start to appreciate how much their body does for them now and become a little bit less demanding on what they think a body has to do or should do or feel like or be like. Um, the other thing I see a lot is people get a lot more autonomy after um, starting exercise programs or therapeutic exercise programs because I think done well, you're not just giving a program, you're teaching people how to exercise, how to move um, in ways that feel safe and comfortable. So um, I think that in general helps alleviate a lot of symptoms when people are like, oh, I understand how my body works, and these are the things I can do to get it to do this or that, you know.
Amazing. Thank you so much for that, Eli. We're going to come back to you in a minute, but I am going to move along because you set me up nicely in terms of our story. So Jennifer has told us that it's good for our bodies to get exercise. You told us there's ways of doing that involving movement and talk and the messaging around it, how we get people to do this. Jimmy Morgan, I'm asking you to take the stage now. How's it going today, Jimmy?
So good. I feel super privileged listening to Jennifer and Eli just because I was like, this is really needed. Just kind of connecting how we need more data in the research side of things. Yeah, I don't, and Eli, the work that they're doing with their clients is very similar to what we're doing on the ice. So
Yes, and so you mentioned your work on ice. So, Jimmy, tell us a little bit about your background. How did you get involved in, tell us a little about yourself and how you got involved in figure skating.
Sure. Yeah. I started in like a good little New England boy. I started in hockey when I was 3 years old. And there was kind of something weird about it for me. It was really cold and people were yelling all the time and they were like, no, hit him hard. And so I was like, maybe this isn't for me. But a couple of years later, around 10 years old, one of my friends was taking a figure skating lesson. So went with her and I was like, oh, there's other options on the ice. There's cool tricks you can do. There's creativity. There's yeah, things like that it just kind of opened my head up to a whole new world.
Amazing. And so now you do coach figure skaters now. And you've developed this approach that kind of really centers skaters connecting with their bodies more. And I'm curious, how did you come across that approach of doing this kind of body work with athletes?
Yeah, I kind of stumbled upon it. I just because of the nature of I'm a choreographer and a movement coach, so a lot of the coaching that I do is supplemental to main training. So if you think about main training like jumps and spins, I work on the creativity side. So we create the programs or we talk about how to effectively execute the choreography so that it's either visible or feels good in the body or is it feels good to the person and authentic to their self. And so what I found was a lot of people were coming to me saying, I'm having trouble doing my jump or my spin, or I can't really necessarily do a crossover and gain speed. And when when we really got down to it, it was an issue of body awareness. And I would talk to them about like trying to use different words about how to activate a core, or what it might look like or feel like. And when I would ask those questions, I would get sort of like blank stares. They would look at me like, what are you talking about? And what I found was that they actually were mimicking the aesthetic of what their coach was doing. So they would watch and then repeat. And so instead, I'm trying to help young kids. And honestly, I had a lesson this morning with a adult, and we're trying to teach them what it feels like to have an activated core and to intentionally move in a way where your brain is telling your body what to do. And I found that there's a lot of empowerment in that, and skaters find that it's actually exciting and it doesn't feel like a slog.
That's amazing. Yeah, I mean, it sounds like good pedagogy, right? Getting people to really think and connect what their needs are. Very
Mhm.
exciting. So, from your experience of seeing people go through your program, what are some of the benefits of being in your body as an athlete? How are some of the outcomes you sort of see for them in their progression?
So I think actually, and I think the topic of autonomy was brought up a couple of times. And for me, what there are so many benefits to it, I think health wise. Um, but autonomy is one of those things that I feel like is so hard to quantify, in a way that when you get a young kid who's interested in a sport and is excited about accomplishing these difficult tasks, giving them the empowerment to be able to work on it themselves is so developmentally important for kids. You know, and seeing them step into a space where they are excited coming to the rink, they're coming to you with, oh, I worked on this specific thing the other day. And it's a lot more mental and physical involvement in what's going on in their body. And for me, selfishly, I really love to see how that then transcends into the creative space. So I like as soon as they feel empowered, then they feel welcome to take up space within the rink.
I don't think it sounds that selfish, Jimmy.
I'm just a nerd. I just like seeing when kids are like, I want to do this crazy program idea.
No, and thank you for highlighting that like element of autonomy and sort of our connection with our body, our connection to be able to do things, to experience the world, to experience on our own terms being such an important thing, especially for queer folks. So I love that you're kind of highlighting that theme for me, doing my job monitoring. I love it. Thank you, Jimmy. I do have one more question for you. When we kind of first talked about this, you mentioned that figure skating was not constructed for queer people. And I was sort of wanted to hear you unpack a little bit. What does that mean to you? And sort of how do you try to respond to that thing of not being built for our community?
Yeah, I think that, well, I'll speak from personal experience. I was a pairs figure skater, so I had a partner for 10 years, and she and I competed together. And a lot of the time, those feedback that we would get from judges or some coaches or things like that was very much centered in a heteronormative space where um, we're portraying this idea, a very widely accepted idea, to get the most points. And this is one of the harmful aspects of an aesthetic judge sport. And so we were told like we would do like Grease and like you need to act like more in love, or I would be the like dead soldier and she would be like mourning my death and like coming back to life. And it was great because we had an awesome relationship, and we were able to step into those roles as performers. However, I found myself craving later in my career for an artistic expression that was more authentic to my experience being queer. And so I would start to ask for more sparkles, or I would ask for maybe we don't need to do a program about love. And so that's just a personal experience. But like a lot of sports, our disciplines are siloed into gender. And so for the solo disciplines, and so um, a lot of the times people are competing under disciplines that don't really authentically mean a lot to them personally. And so I think later in life, I found that that was also my experience. So that's kind of just one example, but yeah, it has a lot to grow into as time goes on.
No, I appreciate that reflection. I think we're often looking for magic bullets and things that are going to be inherently made for us, but that is something that oftentimes we end up having to create ourselves. And even in a space like figure skating, which has a lot of queer associations, it doesn't mean that it was originally meant for us or built for us. So thank you for reflecting on that with a little bit. I'm going to pause our conversation because you set me up nicely to talk about things being built for us. And I'm going to welcome to the stage Jordan Toy. Thank you for being so patient, Jordan. How are you doing today?
I'm doing quite well, thank you.
All right. So I wonder if you tell us a little bit about yourself and how you got connected with Stonewall Sports.
Sure. So I am the community outreach director, but I'm leading the board of Stonewall Sports, and we are a chapter of a nationwide organization that offers queer sports by queer people. Queer people. So talking about queer spaces, right? We create those, and that was the allure of how I got involved. I'm from Indiana originally, and I live in Philadelphia. And I moved out here and I had two friends. And so I was looking for community, I was looking for belonging. And I found that because I noticed that this sports organization existed. And I found the sports organization and I thought, well, let me try a season of kickball. You know, traditionally, I tell a lot of people that we run gym ball or like high school gym class sports. Um, So I joined Stonewall in 2019 and found my community. And then I joined the board a couple of years later. But our goal is to make queer spaces for people. I appreciate that Eli said, that they grew up playing sports. I did not. I was a drama kid in high school. And so this was actually my first experience on a team sport. My first season, it was really wild because we lost every game. But we've gotten better. So for me, how I got involved, I've gotten involved because of that search for belonging and queer community. And I've stayed involved because it's really brought a sense of pride. Being on a team, accomplishing things together, and performing athletically like I never thought I would in my life.
Congratulations. That's great to hear. I also found sports later in life, and I was like, oh, there's like a gap here where I really wish I learned to catch a ball much earlier, but it's fine. We're going to keep going. Um, so I'm curious to sort of what sort of programming do you offer at Stonewall? You mentioned sort of like gym class, but do you do programs kind of in addition to the sports offerings? What else? What's kind of the range of things you do with your members?
Sure. So we offer a wide variety of activities and try to offer points of engagement for our whole community, right? So we're called Stonewall Sports, but we call our organizations, our offerings as leagues because we do have things like we have a billiards league, we have a bocce league, we have a bowling league, dodgeball, kickball, and we have very notably trivia, which does not require any like physical involvement, but still brings people together. And then we offer three different forms of volleyball. So in addition to all of that offerings, we have these one-off events every once in a while, affinity mixers and volunteering opportunities to bring people together.
Yeah, it's sort of interesting in terms of looking at your members, people who come to this. What draws them to Stonewall, and sort of what are the things they're really excited to interact with once they get into the programs?
So I would say a large amount of our membership doesn't come to Stonewall for the sports. They come because they are longing for connection and, like I said, belonging, right, in that community. I'm going to use the example of like, um, I on my kickball team we had a lot of vacancies this fall, and so my captain said, "Well, let's take a bunch of free agents." And so onto our team we had five new people who we've never known, and we brought these people on the team. All five of them had joined because they just moved to Philadelphia. They didn't know anyone and they needed a community. So for us, it was a really great like infusion of new energy onto our team, and a chance to like make a difference in the lives of others in a very small way, but just coming together and having holding that space on Sundays in Marconi Plaza in South Philadelphia.
I love to hear that. Sounds great. And I am also curious to hear you talk a little bit about that intentionality in creating spaces of inclusion and belonging. I think one of the things we have to be aware of is like we can't take it for granted that if it's a queer space, it's going to be a welcoming space. So I'm curious to hear some of the work that you've done in that space to make sure you truly are offering an affirming, welcoming space to people.
Sure. So, we try to, my goal is always, and the board's goal is always to create these spaces where people can come together and it's welcoming. So, like, we have some inclusivity statements and policies, right? So that's one thing. Like, we try to hold our members to a standard that this is a space that people are coming to voluntarily to build community, to get to know one another. So this is sort of what we expect of you, right? It's not ideal when two 36-year-old cisgender white men are arguing on a field over a play. Right? We're like, this is actually what this is about. This is about coming together and having a good time.
Yeah.
So, like, we try to foster a really strong positive environment through that. Something we do specifically for individuals who might not identify with their assigned name or pronouns is we have a patch on all of our t-shirts where we require everybody to write their names so that it creates a really easy point of entry for folks to be able to get to know one another and also to not feel alone, like I'm the only person writing my name here. And then a new initiative we just launched this year was we have what we are calling right now is our She-They Leagues, which is for women, trans folks, and non-binary individuals. And these are special leagues or divisions within our sports where, and individuals identifying as she-they play just against one another. So it creates a special space where, if you don't want to play against a whole team of other queer people who might, have a primarily cisgender or male identity, we can hold that space and we can create those opportunities for engagement across the board.
And it sounds like you've been very intentional about that and kind of creating those welcoming spaces. So it's great to hear that. I'm curious, do you have any particularly heartwarming stories of folks getting engaged with your program and some of the benefits you've seen sort of in the mental health of people who come to your programs?
Yeah, so I know we talked a little bit about my kickball team of people who just moved to Philadelphia and got to know one another, but I've been to weddings of people who have met each other by being on the same kickball team or met each other at the bowling alley. Um, it creates a really good space for these social connections uh, for people to start those relationships, especially in the age of you know not everybody is going out to bars as much anymore, and like we try to provide a space that's not associated with alcohol where people can foster engagement and get to know. And also, I'll add that like a lot of our membership is from 20 to 40s, but we have people as old as 85 playing billiards. So like it's a really we try to create space and we try to create those like life those positive life experiences for everyone.
Amazing. Thank you so much for sharing that. All right. So thank you, Jordan, for that. We're going to shift now to sort of general questions. So friends who are in the meeting, you have a part in this too. I'm going to encourage you. I'll be posting some questions, which I've given them ahead of time, so they've had time to think. But please feel free, participants, drop some questions in the Q&A. I'll be checking from time to time, and so we might be able to read one of yours aloud and have them speculate wildly on something that they're not prepared for. So I'll try not to surprise you too much, everyone, but I want to make sure that our attendees get a chance to ask their questions of all of you. So attendees, feel free to drop those in the chat, and while you're doing that, let me pose my first question to the group. So I'm curious to hear from any or all of you. What are some of the challenges that LGBTQ plus individuals face in accessing inclusive and affirming fitness spaces? So what are some of the things you've heard or experienced or seen?
Well, I guess for some of my skaters, we are constantly searching for locker room and changing spaces. And that's one of the biggest barriers for a lot of kids and for parents looking to support their children, especially at events or shows or things like that. And so not sure if there is necessarily a perfect solution because a lot of the rinks are quite old and the facilities are already created. And so it's all about one of the biggest challenges is finding a equitable space for those people.
I saw you, Jennifer, yes.
Oh yeah, just echoing what Jimmy just said is, the binary aspect of sport and fitness. So, when you go to the gym, there's the men's locker room, the women's locker room, or where do people who are non-binary, where do they go to change? Or, being misgendered, some folks, sometimes I think when I walk into the locker room, sometimes because I've always had short hair and there's, I don't know, this assumption that someone with short hair is male. The women will first kind of go, and then, oh, wait, you're one. Okay, everything's fine. But it's just that makes you feel not welcome, right? And binary nature of men's sport, women's sports, how athletic trainers, approach you like, okay, if you're a woman, you need to do these things. If you're a man, you need to do these things. But if you fall somewhere in the middle, they don't really know what to do. So Eli, I love, what you're doing with your clients as well. So yeah, making the fitness spaces more non-binary, I think is really important. And so that people feel welcome, like they do at Stonewall Sports. Yeah.
Yeah, I saw you nodding your head, Jordan.
Yeah, whenever I think about this, like creating these inclusive and affirming spaces, it's one of the initiatives that we sort of work with is we partner with our local gyms, like local fitness centers or local like fitness studios. So I neglected to mention we do offer yoga and a running group for people who are not as team oriented, or we call them individual contributor sports, right? So we through that program also, we partner with like Rumble, which is a boxing gym here in Philadelphia, and we do special nights for just our community, and they will register through us, and we can kind of create that space. But I think a challenge I think about is like whenever I go to the gym, it's nerve-wracking sometimes, and I work at a university, and I often find myself working around 22-year-olds working out. So I'm like, oh, that's intimidating on its own, right? But then I think about this sort of hyper masculine energy that can sometimes be present in fitness spaces. I think that is challenging to overcome. So when we try to create our like spaces in Stonewall Sports, we try to take the air out of that a little bit to remind people like this is a sport, but we're here for community. So I think that like affirming fitness spaces, it's sometimes difficult just to not feel other in that space.
I was going to add cost. A lot of times, I think is prohibitive in our community. We know that being queer, you're probably not making as much money as your counterpart that's not. So I feel like spaces that would like to attract, or it really is in their mission to attract LGBTQ plus members, also have to think about how they're going to make that financially accessible for those people.
Yeah, we do know that LGBTQ folks are economically disadvantaged. And so, yes, just being able to get there, go there is a big part of it for sure. All right, we have a question from our audience. So this is something new question, so prepare to think. What kinds of suggestions would you make to a high school GSA, that's a gay straight alliance, just so we're all aware, a GSA club who want to help with the physical mental health of queer community in their school? Should they focus on themselves first or open it up to include both queer and straight individuals? What are our thoughts on gay straight alliances in high schools? Maybe you had one you were in high school, maybe you wanted one you were in high school. What are our thoughts? What can we share? What can we shed light on? And you can also see it in the chat if you want to read it.
I'm okay starting with that one. First, Gay Straight Alliance was like the first time I acknowledged being queer at all. I was like one of the allies at first.
Get off the fence.
yeah. It's a low fence. I feel like. I feel like in the beginning, keeping the space just for queer identified people would be a good idea. Just because of some of the things we've talked about around feeling safe and setting the culture of what that activity is going to be like, because as Jordan said, there's plenty of hypermasculinity running around sport and athletics. And I think maybe having those spaces as having both spaces, one that's dedicated for people who identify as queer, and then one where those groups can interact with one another, but just kind of always maintaining that safe space as well.
Yeah, I sort of had some more thoughts as well. You could start them both in parallel and have the meeting for the queer students and the straight students and then integrate them sort of along the way somewhere. So I think, yeah, I had a similar thought, Eli.
I was just going to add that it's been a minute since I've been in college, but when I was in college, I met my husband through his GSA, and we went to two different universities. And his was an engineering college in a very conservative place, and I went to a mid-size sort of liberal arts school. And our two organizations approached it very differently. They had almost a secrecy pledge because it wasn't safe on campus to be out to everyone. And there was fear that you would be outed to your professors or to your RA, right? Whereas we didn't have that fear. Ours was very out and open, and his was like a closed space where they did hold space, like Eli was talking about. So I think it's important that if you're thinking about, how you advise this group, that you consider the culture of the institution and the culture of the student body when you set forth how it's going to function.
Awesome. All right. I have another question. How would you handle this idea of empowerment as sort of puberty comes into play? So like oftentimes when kids are younger, there is this common sort of shared space where boys and girls might play together, and these sort of boundaries of gender are still there, but maybe not as extreme. Are there ways of sort of mitigating as people segue then to high school? Are there ways of sort of helping them with this sort of puberty transition, if you will? Have you heard of anyone doing that work? Has this come up in people you've worked with? What are your thoughts on navigating that change?
Well, in figure skating, you are on the ice with probably like 13 to 20 other people watching them while you're also training. And a lot of what I found is education around, I'm very passionate about like artistic education. So from the perspective of looking at something that you might not understand or you may think is different, and teaching kids that doesn't necessarily mean that it's bad or scary. And so with in a way to not kind of bridge that topic right head on, you can kind of take it on through artistic exploration and say like, well, let's really talk about it. And so, for example, I had a group of young kids, maybe 11 to 13, and we were doing a movement exercise across the floor. So they were pretending that they were navigating through a bunch of small caves. So their bodies were like making weird shapes, and they were ducking and going down towards the floor. And a lot of the kids who were observing were laughing. And so, objectively, it's very silly, but using that as an opportunity to talk to kids and say, like, hey, why are you laughing? Like, there's nothing wrong with what you're doing, but what's going on? And so they were saying, like, it's just funny, it's so silly, and they're making funny positions. And um, maybe just talking about, like, maybe it's not like different or weird. It could just be like different, and you could use that as inspiration for your next piece. Or maybe that's a position you never thought about. And so kind of opening their brains at a younger level, or a younger age, to look at something different and not immediately think it's weird or scary or a threat.
I love that. That's amazing to, think about it and use movement in that way. I think sort of exposing kids earlier, like in puberty, to this idea that gender isn't necessarily binary. Like I was very several decades old before I was ever introduced to like the gender continuum and the sexual orientation continuum, that it wasn't just male or female or boys or girls or men or women or whatever. And so just introducing that to them in puberty so that they can understand, like, if they fit somewhere not on the ends or the extremes, it's okay, that most of us do fall somewhere in the middle, right? And how we can use, like Jimmy was saying, like our bodies to sort of, experience that, right? That we could be, maybe we look a certain way, but we feel a different way on the inside, and using movement to do that's like really amazing.
Yeah. No, making a lot of the invisible visible can be a big part of sort of these conversations, develop them as people and not just as athletes and not just as sort of bodies doing tricks. Um, so I do have another question here, and this will probably be our last question for the moment. Um, because there's going to be one phase after this, but I know we're coming up on 1:30, so I want to be respectful of everyone's time. So I'm curious to have you talk a little bit um, about what role you maybe think cultural competency training can have for mental health professionals and people engaging with LGBTQ people. Are there trainings that we can do to help people who want to engage with a wider audience do so more successfully, to be more open? And kind of what role do you see training the trainers, I guess, has in improving outcomes for LGBTQ folks?
I feel like that's, hugely important. There's cultural competency training that is really geared towards like health professionals. That's sort of where the target has been initially, because like you in your introduction showed how LGBTQ folks are discriminated against in healthcare settings, and Eli talked about that with patients, and so that's really been the focus. I feel like where we're going in the future is that we need that training for coaches and personal trainers and people who work with folks in that physical space, right? Moving their bodies, that aren't physicians or nurses or, physical therapists or whatever. And we just really don't have that. And so I think that's sort of where the next steps need to be, is to make sure that coaches, personal trainers, people, they have that cultural competency. I know with the like transgender sports bans and all the rhetoric that we've heard around that, the really harmful rhetoric, like making sure that coaches really understand, what is gender, what is gender identity, what is sexual orientation, just all of that. And I feel like there's a huge gap that coaches and people who work with folks in the physical moving our body spaces don't get that training. You don't get that as a physical education teacher, in college. And so there's a big target that we need to go for there.
In terms of resources, I can offer Athlete Ally is an organization that works a lot with like NCAA colleges. However, they do have a lot of actionable resources for coaches and athletic directors surrounding, proper usage of pronouns and how to address locker rooms and things of that nature that I've even sent to some of the rinks that I work with, and they're like, "This is what we've been looking for. Thank you so much." So, yeah, definitely check out Athlete Ally for some resources.
I think continuing education plays a really important role, and being intentional about your con ed. Like in physical therapy school, this was a non-topic. But since then, since getting out, I've noticed that these courses are starting to come up. Um, I think ACSM, which is one of the like two big personal training certification organizations, has their own competency, LGBTQ plus competency that they put out. Um, so I think the resources are starting to come about. Um, I think that, unfortunately, sometimes just the way the society is structured, sometimes you have to, play to the dollar. And when you leave out this section of a population, you're basically leaving money on the table because these are people who want to be involved. And something as simple as fixing your language on your paperwork, just little, beginning steps can really open up this whole, new population.
I definitely we've been counting the dollars.
They're out here. Like
Yeah, exactly.
this is a real big part of our society, so we can't like leave that, out of
Uh-huh.
it.
All right. So we have one final treat for you, everyone. So, like I said, we're just over the hour now. Thank you all so much for being here today. I really appreciate the panelist time, the attendees. But I have one more treat for you. If this was an in-person event, when we were wrapping things up, this is the point where you'd rush to the stage and try to say hello and introduce yourself to Jennifer, or Jimmy, or Jordan, or Eli. To sort of simulate that, we have some breakout rooms for you to go to. So in just a second, attendees and panelists, I'm going to put in the chat a link that you can click.